So today we have with us Dr. Scott Stoll. Dr. Scott Stoll received his medical degree from the University of Colorado. And prior to receiving that MD, he was a member of the 1994 Olympic bobsled team. And he currently serves as the physician for the U.S. bobsled and skeleton team. He's the co-founder of the Plantrition Project, the International Plant-Based Nutrition Healthcare Conference, and serves as a member of the Whole Foods Scientific and Medical Advisory Board. And on top of that, he's the team physician at Lehigh University. Dr. Stoll has appeared on numerous national shows, including the Dr. Oz Show, and he is a published author and is a very highly sought after international speaker. So thank you for being with us today, Dr. Stoll.
Thanks so much. It's so great to be with you both. And before we start, I just want to congratulate both of you on what you're doing for diabetics around the world by teaching them the science and then helping them apply it in their lives so that they can realize a fulfilled life, even in the midst of carrying diabetes, but they can learn to live so powerfully with it and understand the science behind it. So you guys are doing an amazing job, and it's just an honor to be with you today. Thanks.
Fantastic. Well, let's hopefully get a lot of your experience here on the table as well. So let's start at the top here. How about we start by you telling us about your Olympic background?
Yeah, it's just briefly, I think so many of us grew up watching the Olympics and wanting to participate. And one of the things I always grew up doing was watching the Olympic bobsled team, and I would get my little sled out after watching the World Championships or Olympics in Switzerland, and I would go polish the runners, and I would sled down my little hill and imagine that I was bobsledding. And so it was always a dream of mine. I ended up running track through college, and I was watching the 1992 Olympics with a good friend of mine on the track team, and I said to my friend Doug, I said, you know what, Doug, I've always wanted to bobsled. And so my friend Doug is a big thinker, and he's a guy that says, why not? And so he called the Olympic Training Center and said, how do we try out for the bobsled team? So I went down to the Olympic Training Center and took their sprinting and jumping test and scored well enough. I was invited to the push championships and pushed well enough after a week of competition that I made the World Cup team, and then went through all the trials and ended up on the 1994 Olympic bobsled team. So it was such an amazing experience for a little boy's dream to come true and end up actually sliding in the Olympics.
Wow, that's fantastic. So going through this experience, leading up to the Olympics and then also participating in the Olympics, what did you learn specifically about sports nutrition and health?
Yeah, looking back on it, what I actually learned is that most athletes have no clue, including myself in that experience. And the ways that we learn about sports nutrition are from our friends, from magazines, from relative experts. Back then it was in magazines or a book, but we really did not have anybody that came alongside of us and taught us like the physiology of nutrition and why you should consume certain foods. And in fact, and still exists today, protein is king in sports. And so if we were concerned about anything in sports, it was making sure that we got enough protein, and then on top of that, enough calories. And we were willing to just consume, big protein powders full of sugar with 1,500 calories, in a couple of drinks a day to make sure we're getting sufficient calories and sufficient protein. And beyond that, in even the Olympic realm, we didn't think that much about nutrition. The only thing we would add to our nutrition are supplements, some of the supplements that weren't banned, like creatine, to try and enhance our performance. But sadly, and even today as a physician working with some of these Olympic athletes, they don't understand nutrition. None of them take the time to truly understand what does your body require to have an optimal performance. And as we'll talk about maybe later, what does your body require for injury prevention, injury repair, and health during a season? So I really had a neat opportunity to see what people don't understand, and then that has really helped me to understand what I need to teach them as a physician working with those teams.
It's really amazing that you had that experience as a U.S. Olympian. It's really incredible. So can you tell us a little bit about what motivated you to study and implement plant-based nutrition in your medical practice?
Yeah, sure, Robbie, because again, I come from a medical background, And in medical school, we get about 4 hours of nutrition, and none of that is really relevant to actually disease prevention, disease suspension, or remission reversal of a lot of these diseases, especially in people living with diabetes. So I started practicing and taking care of my patients, and I would see my patients back, and they would jokingly say, "Dr. Stoll, can't you help me? I'm falling apart." And we would laugh, and I would write a prescription, I would order a test, I would inject them, I would do something to try and mitigate their symptoms and send them on their way. And they would come back and tell me about the bypass surgery that they had just had. They had a diagnosis of cancer. They got 2 medications now for diabetes, another medication for hypertension. And the trend went on. And then there was one day, there was a woman sitting on my exam table, and she said, "Dr. Stoll, can't you help me? I'm falling apart." And I said, "What does falling apart mean to you?" And I expected to hear, my knee hurts, my back hurts, 3 medications, diabetes, hypertension. But she started in such a different place, it really threw me for a loop. She said, "My marriage is falling apart because my husband he can't take the time and energy it takes to take care of my diseases. I haven't traveled to see my grandchildren in 3 years because of my illnesses. I haven't been to church because I can't consistently get out of the house. We're filing for financial bankruptcy because of the medication costs." And then she said, "Can you help me?" And that was one of the most helpless moments of my career as a physician, because as I was scrolling through all of the things that I had learned in medical school and residency, there was nothing there. It was a blank sheet of paper. I had no recommendations for her. And so I left the room that day, and I challenged myself. I said, "Scott, what are you going to do the next time you encounter somebody that is truly falling apart?" And so that started me on this whole research, looking for answers and looking for a way to help people overcome disease in their life and live their best life and use the calling that's been put on them to touch the world positively. And after all the years of research and looking at scientific articles, I realized the answer is really so simple. For the vast majority of these diseases, it's what we put in our mouth. And the solution is plant-based nutrition. The more vegetables, the more whole plant-based foods that we consume, filled with all those beautiful micronutrients and fiber, and yes, all the macronutrients, the more that we consume, the healthier our body becomes, and the more disease-resistant we become. And even more powerfully, I saw that my patients were able to reverse disease. Diabetics went into remission. You know, people with diabetes did not have to take type 2 diabetes, didn't have to take medications. People with type 1 diabetes significantly reduced their insulin dosing and realized much greater blood glucose control and lower insulin requirements throughout their lives. Heart disease was reversed. I mean, just powerful effects that reinforced to me that the answer is on the end of our fork and on our plate.
I love this. Okay. So now, as a sports medicine physician, you encounter lots of patients specifically with type 1 diabetes. So can you give us an idea here about what are some of the common dietary patterns of athletes that are living with type 1 diabetes?
Yeah, unfortunately, you know, in my experience working with athletes with type 1 diabetes, their dietary patterns are really poor. I find, you know, surprisingly that a lot of these athletes don't even understand like the basic diabetic education that's given to type 1 diabetics. You know, the mantra today for the medical world is carb counting. And so even at the most basic level, they show up in the training room and they don't even understand those basic things that the American Diabetic Association would want them to understand. So I find sadly that they are grossly uneducated, and they're just trying to compensate for their diet with insulin dosing, and they really don't know what to do, and they don't know how to overcome this. Some are doing some research on the internet, maybe finding out that like a low carb, high fat diet is maybe beneficial, and so some of them are doing that. But I find that the diets of athletes, especially with type 1, are grossly deficient, and it causes some significant issues for them, especially as they're trying to work around some of the challenges that these athletes face with travel schedules, study schedules, and sleepless nights, some of the food that they may encounter on the road and in the cafeteria, the supplementation issue that many of them also face, stress. I mean, all these things impact their blood sugars, and they don't know what to do.
Let's talk about this, the type 1 diabetes, some of these nuances here. So like you just said, that a lot of people on the internet, they're doing research and they come across a low carb, high fat, also high protein approach. A lot of people are trying that. So how does that play into a type 1 diabetic's life as an athlete?
Yeah, what's really interesting, when I think about an athlete, I try to think about them not only in this athletic prime of their lives and relationship to their competition and their performance, but I also see somebody that's sitting before me that is going to be 40, 50, 60 years old, and that what I'm recommending today is not just for a better performance, but the recommendations that I give today should optimize their performance in their life today with a special eye on who they will be when they're 40, 50, 60, and then disease prevention. So what I have found with my experience with this low-carb, high-fat diet that I've seen in type 1 diabetics in the training room is that, well, yes, they can have, a lower blood glucose level because obviously they're not eating carbohydrates, and especially they've reduced the processed carbohydrates. So that would make sense. Their insulin dosing doesn't change significantly, but what we find, they have some difficulties, with concentration in school because the brain needs glucose to function. I find that they have some difficulty recovering from exercise because your body needs glucose. You need to form glycogen for athletic performance, and so that's not available. And the body needs the glucose as a fuel to, especially in the aerobic type activities, they need that level of glucose for optimization of just athletic ability. So I find their difficulty in maintaining a training regimen. I also find they have difficulty recovery. I find that they have more inflammatory issues, and they have some more difficulty recovering, which we would assess to be true because we know that with elevated protein consumption and elevated fat consumption, you're going to generate more free radicals, more of an inflammatory milieu inside the body, which is definitely going to affect healing from an injury and recovery. We also know from the research when you're consuming high protein, high fat, it alters the microbiome. And in just a few days, the microbiome can shift into more of an inflammatory microbiome where you're generating chronic inflammatory mediators all throughout the body. So we find that that's an issue. I find that they're more susceptible to infections, just colds, flus, all of those things because of the microbiome shift that would occur with a high protein, high fat type of diet. There's been some research too. Jocelyn, I know, did some research, and they looked at people consuming high fat diets, and the high free fatty acid content actually impacted insulin levels for up to 5 to 10 hours and increased requirements. So there is some issues for them in like being able to moderate and understand how much insulin to give themselves because it's increasing that insulin level for up to 10 hours. So the classic cheese pizza that people eat at midnight in college is going to have an effect, in the morning or even a competition that would come up even in the afternoon. And so that's going to alter their insulin dosing. It's going to make it more difficult for them to understand how much to give themselves. So I find that really is, it's a challenge. And there's more that we can talk about, including, just throw this out, and I'd love to hear your comments too, but there's an interesting study that has shown that athletes, because of the fear of hypoglycemia, that's the big fear, they tend to run themselves between 230 and 320 on average. And so they tend to out of fear, they tend to just say, it's better to be high than low, so I'm just going to keep myself high. So in those groups of athletes, the only way to maybe try and moderate that is by getting rid of carbohydrates, eating more of a high protein, high fat diet. So it's very interesting how that plays into it.
I am so glad we are talking about this right now because for people living with type 1 diabetes who are athletic, I almost think of it as though there's two things working against them that are going to drive them towards a high fat / high protein diet. Number one, if you're just an athlete, like we talked about earlier, a lot of the pervasive methodology in the athletic world is eat more protein. And as a result of eating more protein, you end up eating more fat. And then that de facto puts you under a low carbohydrate diet. So that's number one. That just comes straight from the athletic world. And then number two, for most people living with type 1 diabetes, the pervasive methodology, again, is eat a low carbohydrate diet because that's the only way to control your blood glucose. So if you are an athlete and you're living with type 1, you have both of those worlds converging on you, and you have no choice but to say, what they're both saying the same thing. That must be the right way to do it.
Exactly.
So it's frustrating, I think, for a lot of people living with type 1 diabetes, myself included, because I used to be that guy. And I went through, a full year of my life living with type 1 diabetes on a low carbohydrate diet, feeling exactly what you just described. A lot of inflammation, proclivity towards being injured all the time, an inability to recover, dehydration, chronically high blood glucose. And I figured, oh, well, the exercise is going to fix everything, right? It's okay if my blood glucose is high because the exercise will fix everything. But in reality, it doesn't.
Right. Yeah, you're exactly right. And, injury prevention and wellness are so important in athletics. And especially at high level athletics, with working with these Olympic athletes, a small injury at the wrong time can prevent you from making the Olympic team. An illness like a flu or a cold or a pneumonia or a bronchitis at the wrong time can prevent you from, accomplishing something that you've trained spent 4 years of your life preparing for. And so, the injury prevention is really important because especially at a higher level of intensity, you are creating tons of free radicals in your body with exercise. And those free radicals need to be mitigated in some way. And the only way to mitigate those free radicals is through dietary consumption of fruits, vegetables, and whole foods. The high phytochemical antioxidant level of those foods mitigates the free radicals that you will encounter in an exercise bout. And then with all the small micro tears that occur in muscle and tendon, your body needs those phytochemicals and antioxidants for reparative process of tissue after an exercise bout, so that the micro tears don't progress and become a more symptomatic tear of a muscle or tendon.
Yeah, this is really, really important stuff. And we were talking about this, earlier before we started recording, but, it's the idea of following a very, very low carb diet where you literally have to limit your vegetable consumption because it's too high in carbohydrates is really concerning. Can you just talk a little bit more about, the importance of the nutrition value of this high carb diet, like that it comes with all these other nutrients?
Yeah, absolutely. I think one of the things I realized about medicine is that we kind of live under a paradigm of compartmentalization. And so we compartmentalize things down to parts that we can manipulate, test, and then see some outcomes. And so, in people with diabetes, a couple of the metrics that we typically follow are insulin dosing and blood glucose levels. So those are easy metrics to follow. And then we just look at those two metrics, and then we judge, how we're doing in the outcomes of only two metrics. So somebody consuming a low carb, high fat diet can improve their blood glucose, and they can manage kind of a stable insulin dosing. So by two metrics alone, we say, hey, the diet is very successful. However, there are so many other things beyond two metrics of a person's life. Like we just talked about, it's injury prevention, it's wellness for that person. And we know that a whole food plant-based diet alters the microbiome through the soluble and non-soluble fibers and feeds the good bacteria. And in even 24 hours, the microbiome starts to shift over to an anti-inflammatory producing microbiome. As the bacteria get healthy and we're eating all those non-soluble resistant starches, the bacteria start producing butyrate and some of these other byproducts that actually help lower and stabilize blood glucose levels for 4 to 8 hours. So the microbiome has a tremendous effect, and they're only fed by especially the fibers, the resistant starches and the non-soluble fibers that are in whole plant foods. When we're consuming whole plant foods, we get a tremendous bolus of phytochemicals and antioxidants that you will get nowhere else. In one meal, it's estimated that we get 150 different phytochemicals in that one meal. And if you ate a low-carb, high-fat diet, you would get essentially no phytochemicals. If we looked at two meals kind of independently, a high-protein, high-fat versus a high plant-based meal, And we looked at just protein content. You would get 34 grams of protein in a meal of animals, and you would get 33 grams of protein in an animal of plants. So your protein content is essentially the same. If we looked at the fat content is extremely high in this diet, and it's low, 10% in this plant-based diet, exactly what your body needs. If you look at the vitamin and mineral contents, the animal diet has essentially no vitamins, no minerals, except for maybe some vitamin A, vitamin D, and no fiber, and it's high in cholesterol. If we look at the plant-based diet, very high vitamin levels, very high mineral content, very high phytochemical antioxidant content, very high fiber content, things you will not get anywhere else. And all of the research, which is substantial today, showing it's the micronutrient content of your food that optimizes the health of the body. And so for a person living with type 1 diabetes that's an athlete, the only way they're going to optimize their health, and especially looking 40 to 50 years down the road when they're facing diabetes, heart disease, cancer, other issues, the only way they're going to prevent those diseases from occurring in their life is by making the right choice around their food today, which, by the way, will optimize those two original biometrics, blood glucose and insulin dosing, far better than the low carbohydrate, high fat diet.
This is brilliant. I absolutely love the way you just stated that, because you're basically juxtaposing a higher protein animal-based diet and a plant-based diet, one on top of each other. And if you really just look at it metric for metric, you start to recognize that the plant-based diet is actually superior in many, many, many ways. So here's the next question now for you. When we go back to the sports idea, are there any sports that are more problematic for people with type 1 diabetes and sports that are less problematic for people with type 1 diabetes as far as controlling their blood glucose is concerned?
Yeah, it's very interesting. When we look at a lot of competitive sports, there are competitive sports that tend to be more aerobic, cross-country skiing, cross-country running. And, those are the sports, the aerobics type sports, that are going to have an easier time managing their blood glucose levels. The aerobic type activity allows the muscle to be more of a vacuum for blood glucose. And they tend to have a little better time managing and having more stable blood glucose levels, and then understanding their insulin dosing around that. I find that the anaerobic type activities, the more anaerobic the activity, the more challenges I think that they encounter. And I think it's for a couple of reasons. One, I find that the high intensity anaerobic activity tends to put more physical stress on the body. And with that physical stress, there's a rise in cortisol, which is going to affect the blood glucose levels. I find that with the high intensity anaerobic activities, sometimes those sports, they can go from assumptions that it's going to be over in 30 minutes, and the match may go for 2 hours. And so understanding the length and time that those are involved, it makes a big difference in understanding how to dose insulin and how to manage blood sugars going through that. So I think it's the higher anaerobic sports that are more difficult, and the sports that have, varied time duration that are also more challenging for those people with type 1 diabetes.
So what can athletes do to improve their blood glucose control during exercise?
Yeah, it's a great question. And I'll tell you what some athletes do that is not great. There are some athletes that actually, in like women, there was a study that showed that 37% of women in high athletic sports will either skip insulin dosing or decrease insulin dosing to lose weight to improve their performance. This also happens in men in like weightlifting and wrestling. So they play with their insulin dosing to lose weight, because they know when they don't take as much insulin, they can actually lose weight. So they play with that, and then they are willing to suffer the consequences of hyperglycemia, because they then don't have to deal with hypoglycemia. So it's very interesting what happens and what some people do when they're trying to manipulate insulin and blood glucose. But what I find, obviously, the food that you're putting in every day makes the biggest difference, along with that exercise piece. So I recommend just some basic mechanical things. You know, if you're going to be exercising and you need to take your insulin an hour before the activity. The closer you get to the activity and insulin dosing, the more variable the response. The other thing that I found just with insulin dosing, if you're injecting into a muscle like a thigh and you're going to be using that muscle and it's rapidly contracting, it changes the absorption. So I recommend that you use the same location, use a muscle that's not going to be rapidly contracting, and make sure that the insulin dosing is an hour before the activity. Dietarily, a high plant-based diet full of carbohydrates, complex carbohydrates, makes a significant difference. And over time, that plus, you know, that consistent exercise, especially once they get into a stable state of training, they have much more stable blood glucose levels, and they find that they have lower insulin requirements, and it's much easier to manage that because there's a greater stability in that as well. And then I also recommend for athletes, which is important, to make sure that they manage their lives well. You know, obviously in college, you don't want to drink alcohol. That's going to make a big difference in your glucose levels. You want to make sure that you're getting a good night's sleep. You know, when you don't get enough sleep, there's that stress around the body, and that can alter that. And then they just need to be careful with what kind of food they're eating in the dormitory.
Okay, this is great. You know, you're one of the very few people I've ever heard talk about the actual location at which insulin is being injected. Most people with type 1 diabetes hear from the endocrinologist that there's only one type of tissue that you can inject into, and that is fat tissue. So most people with type 1 diabetes aim for insulin injections only around their abdomen. They go somewhere in their oblique or somewhere in their midsection, and that's pretty much it. Maybe they'll go into the upper butt every once in a while. But what you're saying here is that you can inject insulin directly into a muscle tissue, and that your choice of muscle tissue is dependent on the type of activity you're performing. So can you tell us why injecting into a muscle is more effective or less effective than injecting directly into fat tissue?
Yeah, you know, when you inject muscle, it's a vascular tissue, just like just like fat, and you can, you know, if the muscle is not rapidly controlling, the muscle actually gives you a more steady state release into the bloodstream than just injecting into fat. And so, especially for athletes, if they can find a muscle tissue that's not rapidly contracting, you know, if it's a deltoid or something, and they're able to inject there, it tends to be a more steady state in the bloodstream than just into fat.
Very cool. Very cool. Okay. So suppose an athlete comes up to you. So it's a person with type 1 diabetes who says, I want to live an active lifestyle. What would you tell them in turn? Like, you have the opportunity to control their diet and their insulin dosing regimen. So somebody with a blank slate says, I have an open mind. Please tell me what to do. How could you help them?
Yeah, I would, it's a welcome opportunity when somebody says, tell me what to do, and they're willing to do it. And as you know, it's a great opportunity. I would first teach them about the benefits of whole food plant-based diet and help them understand that the carbohydrates in plants, fruits, and vegetables do not have the same effect on the body that all the processed carbohydrates do, when we're looking at cakes and flours and all the things that most people eat today. I would help them understand that, when you're consuming these foods, it has a multiplicity of effects in the human body that are beneficial, especially for a young athlete. And then I would help them understand how to start organizing their diet around whole plant-based foods. How do you do breakfast, lunch, and dinner? And then I would work with them to begin adjusting their insulin dosing to their new diet, so that the diet kind of remains consistent, and then they're adjusting their insulin dosing based on the requirements. I would help them understand the importance of managing their lifestyle. Stress is important, and limiting stress to limit that cortisol effect, which can cause some variation. How to manage stress, how to get a good night's sleep. I would teach them about some of the potential pitfalls in college, types of food and alcohol. And then I would teach them about exercise, aerobic exercise, the benefits of aerobic exercise, how to deal with training and competition, and how to prepare for that, how to adjust their insulin. But the most important thing is getting that dietary piece in place, because when the diet's right and the exercise is right, Those are the two optimal pieces that allow them to live in a position where they have victory. They're kind of overcoming the disease that they have to live with, so that they can have a life where they have consistency and they don't have to fear hypoglycemia, and they don't necessarily have to worry about these hyperglycemic episodes after their competition.
Really, really great stuff. So we've covered a lot of great information here for type 1 diabetics. And I know you run immersions and you work in your practice, and I think you see a lot of type 2 diabetics in those sort of events. So can you tell us what you see with type 2 diabetics who follow your dietary recommendations?
Yeah, we have found through the years that type 2 diabetes responds very quickly to a whole food plant-based diet. What's interesting, I'll just take one step back to tie these two together, because what a lot of people don't understand about type 1 diabetics, especially when they're not managing their diet well, is they can develop insulin resistance just like a type 2 diabetic. And so that's a very important point to recognize, because type 1 diabetics and a lot of athletes don't understand that, by just giving themselves enough insulin to compensate for their diet, that they're going to be okay, but they develop insulin resistance over time, which makes their disease more difficult to manage. And so type 2 diabetes, which has been the result of insulin resistance over time because of poor dietary practices, we find the whole food plant-based diet within very short period of time at our immersions, within a week's time, we have people using 50% less insulin. This last immersion, we had an older type 1 person with type 1 diabetes that came, and he in 1 week reduced his insulin requirement by 50%, eating a whole food plant-based diet as much as he could possibly eat. And the same thing we see with type 2 diabetics. We discontinue sometimes 2-3 medications in 1 week when they transition their diet, so that it seems like the tissue is very responsive. Even in people with some chronic brittle diabetes, they can be responsive and significantly reduce their medications and their insulin, which then translates into a significant reduction of all long-term complications and associated problems in people with type 2 diabetes.
This is brilliant, actually, because in our coaching program, we see the same thing, which is that we take people with type 1 diabetes, we transition them to a low-fat, plant-based whole foods diet, and all of a sudden their insulin requirements start falling between 25 to up to 60%. So I'm glad to see that what you experience is also very similar to what we'd be seeing over and over and over again.
It's amazing, and it's an awakening for these people, because they're doing something that they're not supposed to do. According to traditional teaching, you're not supposed to eat all of these fruits and berries, and you're not supposed to eat so many vegetables in a diet that's maybe 70%, quote unquote carbohydrates, but it's fruits and vegetables and beans, lentils, and achieve better blood glucose control and lower insulin requirements at the end of a week. It's remarkable. And I think it breaks a paradigm for them and gives them tremendous freedom and understanding to know that, I can live this way, I can enjoy my food, and I can feel better and know that I'm doing the right thing for my body long term.
So people, they come to your retreats and you feed them all the food, you take care of that. What sort of tips do you have for when they go home? How do people stick to this new diet for the long term?
Yeah, that is the $1 million question right there, Robbie, because that is the great challenge. I think today, we live in a culture and a society where we have come so far the wrong direction in 100 years that you go back into a culture that is not welcoming of eating fruits and vegetables, and you have a lot of people that criticize you, and the first thing they say is, well, where are you going to get your protein? So I try to equip people with education and knowledge, and just how to answer some of these most basic questions. For the protein thing, I always give them this little tidbit, because I think it shuts the conversation down. I always tell them, when somebody asks you about your protein, ask them this question. Ask them, do you know how much protein is in broccoli, kale, and collard greens and romaine lettuce? And when they say no, you can say, well, a piece of steak per 100 calories has 5 grams, and a piece of kale per 100 calories has 12 grams of protein. Broccoli has about 10, and romaine lettuce has 11 grams of protein per 100 calories. So if I'm eating enough calories from fruits and vegetables, I'll get more than sufficient protein in my diet. And that pretty quickly shuts that conversation down. So I try to educate them. We try to give them recipes, because learning to cook whole plant-based food is new for most people. You know, most people today, 63% of their diet is processed food, and so they're eating, you know, foods that are in packages and require very little processing. And so there is some culinary education that needs to become a part of their new lifestyle. You know, how do you make breakfast, lunch, and dinner, and how do you make it efficiently? We try to give them shopping lists to understand, you know, how to shop in a grocery store and purchase the food that you need. We try to teach them how to make food delicious through the use of spices and herbs and the combinations of food, because the food really needs to be good. We teach them about, you know, some of the risks of things like sugar, fat, and salt, and how they work on the receptors in the brain where cocaine and methamphetamine and heroin work, and understanding the power of food in their lives. We teach them about emotional eating and how dangerous it is to use food as a counselor, and that, you know, it's important to just deal with the emotional issues. You know, seek counseling, get some assistance, forgive people, resolve that emotional burden that's driving you to eat unhealthy foods that's causing damage to your body. You know, we teach them how to deal with children and families, you know, how to understand how to work with children and how to work with resistant family members. So we try to come at it from a, you know, a multiple effect in their lives and help them deal with the different situations that we'll encounter. But we always encourage them with two things. Your taste buds will change in as little as 2 weeks. So that's the good news. And then, you know, within 6 months of making a healthy transition, it becomes a new way of life, it becomes a new normal. And within 6 months, you're transitioning right back into a new way of living that's actually going to be healthier. It's going to save you money and time, and you're going to feel better, more energetic, and with much greater mental clarity every day.
This is phenomenal. Now, let's go back to what you said earlier here about the fact that when you were in medical school, you learned nutrition for 4 hours, right? There's plenty of physicians that are currently taught in the medical school paradigm that exists today, where they get, you know, 4, 10, 15, 20 hours of education in nutrition, and that's it. And they get thousands and thousands and thousands of hours on, you know, clinical rounds and how to prescribe medication and all the contradictory, you know, the contraindications between medications. So could you talk about how physicians and medical professionals who are listening to this can learn more about plant-based nutrition either through the Plant-Based Nutrition Health Conference or through the Plantrition Project?
Yeah, thank you for asking, Cyrus. And one of the things that I recognized early on is how much time I actually spent myself trying to educate myself by reading books, reading tens of thousands of articles online, trying to go spend time with other physicians. I recognized there was a real deficit and a real need for education of healthcare practitioners. So I was sitting at my kitchen table one night with one of my partners, Tom Dunham, and I just mentioned Tom. I said, you know what, we need to start a conference to start educating physicians and allow them the opportunity to begin interacting and collaborating around plant-based nutrition. So 4 years ago, we had our first International Plant-Based Nutrition Healthcare Conference, and we just had our 4th annual conference this year with 800 practitioners from 20 countries. So it's been awesome to see all of these people, these healthcare practitioners, coming to this conference, learning the science of plant-based nutrition and learning how to apply it and going back and then changing their patients' lives. We also created the Plantrition Project, which is a 501c3 not-for-profit that is designed to educate, equip, and empower healthcare practitioners around the world with the knowledge and the understanding and the tools around plant-based nutrition and utilizing that as a foundation in their practices. So plantritionproject.org and PBNHC is the conference. You know, those are great resources. Neil Barnard with the PCRM has a great physician network that he's created, and he's been an amazing pioneer in this for many, many years. And some of the others that have also done incredible work, John McDougall, Joel Furman, have all done remarkable work through the years. Michael Clapper out there on the West Coast always does a fabulous job as well. And then nutritionfacts.org, Dr. Michael Greger, free resource, online, amazing research that is given out every single day. And it's a tremendous resource for all of us and all healthcare practitioners that want to see the science behind plant-based nutrition.
I just want to tell everybody that Cyrus and I, we were at the last conference this past year in September, and it's amazing. If anybody is listening to this and considering it, cannot recommend it enough. Absolutely got to go.
Yeah, it's actually one of my in the decade that I've been involved in plant-based nutrition, actually more than a decade now. The International Plant-Based Nutrition Health Conference to me was one of my absolute favorite, 2 or 3 day periods, because it combined the medical world, what I call the super nerd world, with the plant-based nutrition world. And a lot of the times on the internet, there's a lot of, people talk about various dietary strategies, but they don't necessarily have the credibility to really put forth recommendations. So this is a great opportunity to get the science and plant-based nutrition all put together in one spot. And at that point, you can really learn an incredible amount of information in a really short period of time.
And you also get to eat the food. There's the meal.
Yes.
It's really terrific. It's a wonderful experience. So
yeah.
Thanks so much for being here with us today, Dr. Stoll. I feel like you have a ton of experience here working with people with type 1 diabetes, which is actually quite unique. And then you also have plenty of experience working with people with type 2 diabetes. But most importantly, you're also bringing the plant-based nutrition world to a whole new level. You're putting it in front of physicians, because the physicians are the ones that are eventually going to have to learn this information so they can pass it on to their patients down the road. So thank you for doing what you do, first of all. And please continue all of your excellent work.
Thank you. Thank you, Cyrus. Thank you, Robbie. It's an honor to be with both of you. And I commend you for what you're doing and offer all of my support, and have great confidence that you all are going to make a tremendous difference around the world with your education and people living with diabetes. So, awesome. Good job.